I am the mother of a current football player, but I'm also the wife of a former football player and the daughter of a former football player. I love football and always have, but I also love my son. So when at age 8 he said he wanted to play football, being a neurosurgeon now, I thought it was important to check to be sure that I wasn't sending him down a dangerous path. So I called my friends who were the team physicians for the Colts and for the Pittsburgh Steelers and asked them, what should I do about this? Is it safe for my son to play football? And what they told me I thought was really good advice. They said, when he plays at this age, at the youth football age, the chance of having injuries, significant head injuries, are roughly the same as they will be in any other contact sport. My son has enjoyed football since age 8. We've enjoyed it with him. We love the game, but we want to keep it safe for him and for all the boys who play. It's really any change in neurologic function or any change in brain function as a result of a blow to the head. In the old days, people used to believe that you had to be knocked out to have a concussion, but that's not true. In fact, only about 10% of patients or people who have concussions have had a loss of consciousness. So there's a lot more that goes into it. You know, there's been a lot of focus on football lately, but you might be interested to know that football is not the sport that causes the most number of sports-related concussions. It's actually cycling by a long shot. We love our sports. We like all of our sports, but we want to keep them safe. So people often ask, well, how do you know if you've had a concussion? There may be confusion. There may be headache. They may feel lightheaded or dizzy. There may be nausea. These are just some of the symptoms. Other things can be more subtle. Being bothered by light or noise, being irritable, having difficulty focusing or maintaining concentration, even having difficulty sleeping. So these are all the kind of things that may be noticed by the injured player or by a coach or a parent that need to be reported and investigated. Number one, we want athletes to be honest about what they're feeling and self-report. The next step is we want their teammates to report to protect them. And of course, we want the coaches and the athletic trainers. When we see an athlete who's had a concussion, we know that they need rest. They need physical rest and they need cognitive rest, meaning they don't go back to school either, because we know that that also is part of the work of the brain and it's taxing on the brain. All concussions are serious. Don't hide it. Report it. Take time to recover from it. It's better to miss one game than the whole season. And it's better to miss a season than to ever injure your brain. And for further information on this topic, go to cdc.gov, concussion in youth sports, or thinkfirst.org.